Hi everyone, my name is Anmol Ritu and today I will be presenting on anxiety disorder as part of my course RMBP program. We will look at what anxiety disorders are, their biological basis, nursing management and community support. Moving on to the next slide, let's begin with a short overview. Anxiety disorders are among the most common mental health issues. In Canada, affecting about 12% of adults every year according to the Center for Addiction and Mental Health 2024. They cause significant distress and interfere with daily functioning in work, relationships and overall quality of life. This picture reminds us how anxiety can take over both the mind and body. Now let's go to the next slide and learn what anxiety disorder actually means and its types. Anxiety disorder is defined as excessive and persistent fear or worry that interferes with normal functioning, according to Halter 2021. There are 4 types. First one, generalized anxiety disorder. People with generalized anxiety disorder experience chronic excessive worry about everyday situations such as health, work, or family. They often report restlessness, fatigue, muscle tension, and difficulty concentrating that persists for months. Second one, panic disorder. Panic disorder involves recurrent, unexpected panic attacks, sudden episodes of intense fear with physical symptoms like palpitations, dizziness, and breathlessness. The fear of having another attack can lead to avoidance behaviors and social withdrawal. The third one, phobias. Phobias are irrational and persistent fears of specific objects, situations, or activities such as heights, spiders, or flying. When exposed to the fear trigger, individuals may experience immediate anxiety and avoidance that interferes with daily life. The last one, social anxiety disorder or social phobia. This disorder is marked by intense fear of being judged or embarrassed in social or performance situations. People may avoid speaking, eating, or interacting in public, which can significantly affect their relationships and careers. Moving on to the next slide, let's see what factors can cause anxiety. Anxiety is influenced by many factors. Genetics. Genetics play a major role. People with a first-degree relative who has anxiety are up to 5 times more likely to develop it. Biochemical factors, which include low serotonin and GABA and higher norepinephrine levels. Psychological factors. It involves negative thinking patterns and trauma. Environmental stress such as life changes or job strain can worsen symptoms. And finally, cultural factors. Stigma, especially in immigrant communities, can prevent people from seeking help. On the next slide, we will see what happens inside the brain when someone has anxiety. Anxiety is not just emotional, it's biological. It involves several brain areas including the amygdala, hippocampus, prefrontal cortex and HPA axis, which together control fear and stress responses. Imbalances in chemicals like serotonin, GABA and norepinephrine make it harder for the body to relax. That's why people with anxiety often feel both mental and physical symptoms like racing heart and tense muscles. Let's move on and look more closely at these parts of the brain. The amygdala detects threats. It becomes overactive in anxiety. The hippocampus, responsible for memory and context, can shrink under stress. The prefrontal cortex, which controls impulses, becomes less active, so the amygdala is not properly regulated. And the HPA, that is hypothalamic pituitary adrenal axis, which controls cortisol, stays hyperactive, causing ongoing stress responses. Now, let's move on to the next slide and meet patient who is living with anxiety. Let's meet Maria Lopez, a 35-year-old Filipino-Canadian from Charlottetown, PEI. She has been diagnosed with generalized anxiety disorder for 3 years, which worsened after childbirth. She also has mild hypertension and lives with her husband and 2 children. Her family and church community are supportive, a major strength for recovery. Let's go to the next slide to learn about her progress in treatment. Maria has completed a 3-week inpatient program where she participated in cognitive behavioral therapy and relaxation exercises. Her sleep has improved and her anxiety level decreased from 9 out of 10 to 3 out of 10. She is being discharged with a plan for outpatient therapy and continued family support. Moving on to the next slide, let's see how nurses use the nursing process to guide care. As a nurse, we use the nursing process: assessment, diagnosis, planning, implementation, and evaluation to provide holistic care. Let's explore some communication strategies and the nursing diagnosis that helped Maria. Now, let's look at the communication strategies used with Maria. One helpful approach is using active listening and guided relaxation. For example, I might say, "Maria, I can see you are feeling overwhelmed. Let's take some slow breaths together." This builds trust and helps reduce her physical tension. Another approach is exploring through journaling. I might ask, "You mentioned worrying about your children's safety. Can you tell me more about that?" This allows her to share fears openly, helping identify triggers and plan coping strategies. Let's move on to see her nursing diagnosis and goals. Our first nursing diagnosis is anxiety related to perceived threat as evidenced by restlessness and insomnia. The goal is to reduce anxiety to 3 out of 10 within 5 days. Interventions include maintaining a calm environment, teaching deep breathing, and encouraging emotional expression. Now let's see if our plan worked for her. After these interventions, Maria was able to demonstrate relaxation techniques and identify 3 personal coping strategies. That shows progress toward her goal. Let's move to the next slide for her second diagnosis related to sleep. The second nursing diagnosis is disturbed sleeping pattern related to excessive worry. Our goal was for Maria to sleep at least 6 hours per night within a week. We implemented a bedtime routine, advised avoiding caffeine and screens at the afternoon, and taught guided imagery. Now on the next slide, let's see how this plan helped. Maria reported sleeping 6 hours for 3 nights and waking up feeling rested. This shows her anxiety and sleep issues were stabilizing. Let's move on to see how her personal, cultural, and family support factors were included in her care plan. When developing Maria's care plan, I considered her developmental level, cultural background, and family support. At 35-year-old, Maria is an adult learner who benefits from being actively involved in her care. So I provide education that promotes independence. Culturally, as a Filipino-Canadian, she values faith and family relationships. including her husband and church, in health teaching respects her beliefs and strengthens support. Next, let's move on to her medication and how we teach about it. Pharmacologically, Maria takes sertraline, Zoloft 50 mg daily, and selective serotonin reuptake inhibitor SSRI. It increases serotonin levels, it helping improve mood and reduce anxiety. Let's go to the next slide to discuss how we teach her to use it safely. When teaching clients about sertraline, it's important to explain that it must be taken every day and not to stop it suddenly. It may take about 4 to 6 weeks to feel better. Clients should call their provider if they feel more anxious or have suicidal thoughts. They should also avoid alcohol and herbal supplements like St. John's wort, which can interact dangerously with SSRIs. Now let's move on to the next support Maria can receive in her community. Community organizations such as the Canadian Mental Health Association play an essential role in the continuity of mental health care after discharge. They provide peer support programs, psychoeducation, and self-help groups that help clients maintain coping skills learned in hospital. These services also reduce social isolation, connect clients with counseling, housing, or employment support, and teach relapse prevention strategies. For clients like Maria, participating in these programs encourages confidence, normalizes recovery, and promotes long-term stability in the community. Let's move on to the next slide for more local support. Additional resources include the Health PEI Working Clinic for follow-up and the PEI Association for Newcomers, which provides support to immigrants managing stress in new environments. Now let's move to the next slide and discuss what to do in a crisis. In crisis, Maria or her family can call the mental health crisis line at 1-800-218-2885 or Kids Help for younger clients. Having these contacts ensures safety and continuity of care. Finally, let's move to the last part, our conclusion. To conclude, anxiety disorders stem from brain dysregulation but respond well to holistic care. Combining communication, medication, and education helps recovery. Discharge planning and family support prevent relapse, and early recognition makes a big difference in long-term outcomes. Continuous follow-up and community engagement empower clients to maintain coping strategies and improve quality of life. As a nurse, our compassion, knowledge, and advocacy play a vital role in helping individuals regain confidence and emotional balance. Moving on to the last slide, let's look at the references used. Here are the references used, including key text from Halter, Wiedebeck, Balzer, and others. Thank you so much for listening to my presentation.